Hey guys, how you going? Leki and Aarvi here. We are in season 1, episode 10, and we were a bit busy last week, so I apologise we missed you. But we're going to dive into top questions we get in the clinic, commonly asked questions, and we just want to walk through them, and I hope you enjoy it.
Yeah, before we get started, I just wanted to give a quick shout out for Movember. So Movember's officially finished, and I still sort of got my mower going, just waiting for the beard to grow back.
Look at that slug. Oh.
Me and my mate raised just shy of $1,000, and a big shout out to Dr. Jacob who donated $200. So thanks for that. And yeah, so keep donating. You can still donate if you have some spare change around. But thanks for everything. Cheers.
Awesome. We'll get everyone on board next year, maybe even the ladies. All right. Question number 1 I get commonly is when you should think about getting some scans. All right, so this is, it's almost like a clinical rationale question because you're not wanting to waste people's time and money if you're haphazardly referring people to go to get scans. So I think number 1 is if you have a well thought out game plan. So if you're a professional that you're seeing, after maybe 1 or 2 visits, you've been really compliant with the advice that you've been given and you're not seeing the results that you thought that you would have got, maybe it's the time to ask the specialist or the allied professional whether it's time to get a simple x-ray even, or if it's an ultrasound, or even an MRI, which is our gold standard of imaging. So when I say scans, there's a couple of different types that you can get, and I'll give you one specific example. So there's a fellow that I'm managing at the moment. He's under work cover, and he had an ankle surgery. He broke his ankle, fibula, pretty badly, and so he had some plate and some screws. And fast forward 5 months, which is where we are now, he's still getting this weird heel pain, okay? Now, we had done everything that we had asked. We had screened him. He's improving in some capacity, but this heel pain was still getting quite sore. If he walked and did some shopping at the local plaza, his ankle would swell up. And so this is really disheartening for someone that's working really hard. You know, he's already followed up with the orthopedic specialist twice, and the orthopedic surgeon said, look, you're fine. It's healing really well. Don't worry about it. It'll take time. And he was unconvinced. So I organised an x-ray for him, and we found that there was a secondary fracture out the back there, So I was following the guidelines of what the surgeon recommended, but you, the person that's managing the pain, you know your body really well, okay? So in that particular instance, getting a scan because something wasn't responding to our treatment protocol was really important, okay? So that's one example, a broken bone. Another example is if, say, you have back pain, and you got that referred sciatica pain, it's pretty scary. Sometimes you just want to jump on that grenade straight away and get all the scans to make sure what you have is maybe a disc bulge, there is a nerve being pinched, so it gives you that referred leg pain. If you do get a scan and it says it's a disc injury, how would that change if your original diagnosis was a disc injury and we're managing it that way already? It would give you the confirmation, sure, but I think if you've been given great advice, you understand it in a way that makes sense to you, then we would reduce the pressure of you needing to get a scan. So in one case, there is, say, an acute pain, you manage it for a while, things don't seem to be sitting quite right, get a scan, an x-ray, and it picked up something. The second example I gave you was you have, say, 4 to 5 weeks worth of low back pain, it's starting to get worse, then you decide to go see somebody. Then we diagnose you as having a lower back disc irritation perhaps. And so with the advice and the information, the education we give you, we would say, look, maybe hold off from getting CT scans and MRIs right now. Let's just try a couple of sessions of, straightening things out with what we would do anyway if you got some scans. And if it doesn't come around with what we've given you, then sure, we can think about getting some scans. So I guess in terms of that question, when should you get scans? A lot of it is a two-way street. So have open communications with your professional. As long as you feel like you're getting the guidance and the results, then that can maybe tell you when you should get the green light or the red light. Okay, hope that makes sense. Those were really good examples that has actually happened to patients that I've managed this week. So it's a very real question.
All right, sweet. So I'll jump into the next one. A lot of the times I get asked quick ways to get fit. So pretty much more talking about the cardiovascular, so to get the cardio a little bit up. So most of the time A lot of people come in, oh, how can I get fit real quick? I got pre-season coming up, or I got I'm just an older, usually an older person that just wants to get fit, start walking around and do some everyday activities. So it can vary for each person. So having a higher cardiovascular respiratory system, you can get around, do a bit more. So my best tip I give to anyone, there's no point just doing like long, nice slow jog for like a couple of hours or like a long 2-hour walk, because in the same amount of time, because everyone's pushed for time, you can burn the same, even a lot more in about 15 to 20 minute high interval session, so high interval training. So what's that consist of? It's pretty much what gets your heart rate jumping. So you can, if you like going to the gym or something and you want to get fit, combine like 2 to 3 exercises, like maybe like a sled push, bit of star jumps, or like a box jump. That's like more high level. Or you can just do simple like a body weight squat, a lunge, and just some jumping jacks. Combine it, do like a 3-minute round, just go after one another, have a minute rest, then repeat a couple of times. And your workout's probably about 15 minutes there, and you've sweating pretty heavy, and your heart rate's up, and you're getting around, and you get fit a lot quicker, because that way, for fitness, you need the heart rate pumping as much as you can. And then when you're running around, if you're going for a light jog, your heart rate doesn't really get to that point, and you're just maintaining that thing. So the only time I would say do that kind of activity, if you're running a marathon, or if you're doing like a walking marathon or whatever. So you got to do what you pretty much practice. So, but otherwise, if you just want to get fit, some high level circuit, just even so, something me and Leki always prescribe, especially for people that have pre-diabetes or diabetes, just a simple 6-minute exercise. So pretty much all it is, grab a chair, you do sit to stand. So sit, stand up, sit,
squat,
stand up. Pretty much can be done anywhere. Do that for a minute, and then you go up over to the wall and you do like a wall push-up. So it gives your legs a bit of a break, and you just do that for a minute, and there'll be steps somewhere. Just do a step. So step up on the step, come back down, and do that for a minute, and you repeat that twice with no break. That's 6 minutes, and that's only 6 minutes out of 24-hour day. So it's not long, and you get a good workout out because your heart rate's pumping. And as you get fitter, you can hold on to some weights, or you can go a little bit quicker. So many variations. So that's for someone that just wants to do something at home, or if you want to go a bit more advanced, get to the gym. There's so many other things. Just combine 2 to 3 exercises together, and just do anything. So another good option is some long sprint, like some sprints, and then you do like a bit of plyometrics work, like a jumping squat, then do a sprint again, or some burpees, and you'll be fit in like a couple of weeks. You'll notice a big difference instead of just doing laps around the oval. So that's my big tip to get fit. Any input on that?
Yeah, that's a massive one. So HIIT training can be a bit of a flavour of the month thing, but just make it really simple, you know. So there's variations. Like Aarvi's got a couple of different circuit things. Personally, I like the stationary bike, and I push really hard for a certain period of time, and then I sort of coast, but I keep the body moving. The idea is you want to be working at a sub-maximal level for a consistent period of time, but not for hours, like walking and running for 2 hours. But if you got that short blast, that's the idea. If you think of F45, the whole premise there is that you're doing some functional movements for 45 minutes. So it's like circuit training. But again, depending if you're pre-diabetic, if you're agility athlete, or if you're just looking Joe Blogs in the office, you can still do any HIIT training in your environment. So really, there's no excuses. So if you're asking that question, how do I get fit? HIIT training is a big one. All right, so I'm going to be using Aarvi as my mannequin, but another common question we get is postural pain, or it's a common term, it's an umbrella term for lots of different pains. And so I'm going to give you our spiel. This is the way that I break it down in lay terms, so that we can grasp it. Because in the end, we're all simple creatures. You just want to understand it at a grade 5 level, so that way we can get the message across to you, and that you can understand it and apply it in your own day. Okay? So postural pain, what is it? I'm going to ask Aarvi to just flip around. He's going to turn around. I'm putting him on the spot here. So we all have big, heavy heads, okay? It weighs like a bowling ball, 10, 15 kilos. So in terms of the anatomy here, we have this big bowling ball head that we need to keep up against gravity for a long period of time, your waking hours. So away from the big head, we have your spine and your shoulder blades on either side, okay? Now, around your shoulder blades, there's 3 key areas that we're really interested in, okay? There's muscles that go between the shoulder blades, there's muscles that sit from the top of the shoulder blades into the neck, and then there's muscles that go from the shoulder blade into the shoulder. Okay, so those big muscles that go from the shoulder blade to the shoulder, they're commonly called your rotator cuff muscles. Okay, so they do all the big heavy lifting, all the power stuff throughout the day. Okay, the other two muscles I just mentioned, the ones that sit in the middle and the ones that sit up the top, their primary focus is to hold your head up against gravity. So I would suggest to you that your postural muscles are these bad boys right here, between the shoulder blades and the muscles around the top of the neck, because they all go and eventually end up in and around the neck. So what happens is when you get postural pain, there's an issue of a breakdown because all these ropes, all these muscles are working together because you swing and move your arms all day, your head is being held up against gravity, and you're bending, lifting, pushing, pulling, sitting all day long. Okay? Now what happens, given that we're sitting in this forward position all day, typically if you're an office worker, if you're out working on the trains, being a tradie, is you will find your shoulders will tend to lean forward. Now Aarvi's exaggerating here, but if you're leaning forward, you're going to overload the shoulders, which will then put more strain on these postural muscles, who, remember, are doing a heap of work keeping your head up against gravity. So what are common signs of postural pain? You get this tightness and headaches from the muscles pulling from the neck. Okay, so you get tensions in the head, neck-related headaches. You can get neck stiffness. You can get really tight upper traps. They could feel like rocks, you know. You can get this stiffness around the middle of the back for ladies, around the bra strap level, really stiff and kind of this burning sensation. And then you can get these sort of weird shoulder pains. You know, so for some people that come into the clinic, Aarvi and I really take a close look at these sorts of presentations, because it may be a simple injury or issue in the shoulder, but it's from an underlying postural problem. So that's the spiel that we put, thanks for that, Aarvi. So that's the spiel that we put everyone through in terms of what postural pain is. So it's a blanket term for lots of micro problems, which leads to a massive macro problem, which we call postural pain. So if we are finding that you have, say, neck-related headaches, the underlying problem is this postural dysfunction, which we want to try and correct. So we'll throw a few treatment options at you, maybe some manual techniques where we get in there and try and loosen things up. But to fix it, so the manual hands-on stuff will give you some short-term relief. But if you head back out into the office, you're out back on the tools, within a couple of days or weeks, doing the things that you normally do, that headache will come back again. So that's why we're really big on actually getting to the cause of the headache in this example, which is that postural pain, this environment where they all work together. So I hope seeing that makes sense to you. That's basically how we explain postural pain to everyday people, and we find that that's well received. People can kind of see the picture now, and it makes sense rather than being just a vague term like postural pain.
Just add on that, just a quick tip that me and Leki and I give to most people. Just imagine you're wearing a crown on your head and you want the crown to be facing the ceiling. So what that does, it just sort of pulls you up. And every time you're working on the computer or you're a bit busy and you just remember that cue, just do that slightly, and that's where the posture just looks a bit better and those muscles are working a bit more evenly instead of one area working harder than the other. So that's just a quick tip to use whenever you're in the office or wherever you are. Crown on the head, point it to the roof, and it just lifts your chest up.
Nice.
All right. Cool. So the final one is stress tips. So I do get a lot of people coming in just asking, or I wouldn't say asking, just I have to give them a lot of tips to how to avoid stress and all those kind of measures, because stress and pain are very closely linked. So if you usually have high levels of stress, you're going to get higher levels of pain usually, especially with low back. We find that a lot. I probably get at least 2 to 3 people a day with the same issue, and you ask how their stress measures are, what they're doing. There's not much. So a couple of things that I like to look at. So big one is the food. So the food you eat. So I'm guessing you probably see Leki's stories and stuff about his ketosis and all that kind of stuff. So he's got his side, and it's got its own meaning. So it might be a different chat. That's a long chat somewhere maybe later down the track. Or there's other foods. Just trying to eat as healthy as you can, really. So I'm not saying don't eat junk food. Just try and in moderation is good, because the reason being, you're eating a bit more junk food, you get more tired, you're more lousy, and then you're getting burning out just because you're a bit more tired and can't get all the work done, and you feel sleepy and all that kind of stuff. So foods is a big one, and the other one is sleep. So yeah, really recommend trying to get like at least average of a week, 8 to 8.5 hours of sleep. Some days you might get less, some days you get more, but just a sort of an average. There's a lot of people that get a bit less, but people work differently. But that's just a standard 8 to 8.5 hours of sleep. That's good quality sleep. So, and how do we sort of get better sleep? Because everyone's like, oh, I can't get to bed. A big one is your phone. So there's this blue light setting that you can sort of switch off, and then that can affect. And main thing I like is don't use your phone in bed at least a couple of hours before. So because that will help you wind your body down and just relax. Because the phone you get more into, especially when you're watching a YouTube video. Personally, I do. I'm watching YouTube and I get really intrigued and I forget what the time is and it's like 2 a.m. and I'm like, oh,
Surfing around.
Yeah, so that's a good tip. And exercise. Just doing a bit of exercise daily, even half an hour, 20 minutes. Like my other previous question, a bit of interval stuff. Any kind of exercise, even a walk is good just before bed. And then, yeah, so there are a couple of tips that I like to use. Any other tips you have?
No, I'd just reinforce them. Yeah, so if they're strong pillars for stress management, good sleep, eat real well, and a bit of exercise, I think that's really good tenets.
Sweet as. So that's both of our question Q&A's done. We'll be back next week with more. What are we talking about next week?
So I think we've got Aarvi's under the microscope. He's doing his five W's.
Yeah.
So who, what, where, why, and when. Yeah. So just refer to mine. I think I did a month ago, and it's pretty interesting. It just dives deep. The theme of the 5 W's will be high school. So we'll transport back in time to when Aarvi was in high school, and you can give us some context because there's some school leavers that are leaving. And Aarvi can tell you about his frame of mind at the time and how he's landed into physio. But things at that time are very different to now. So that's where the interest comes from.
Sweet, that's us signing off.
Cool. See you guys.